Good evening, everyone. So happy to have you here on this Thursday night of May the 28th, 2026. And I am delighted to introduce myself. I am Dr. Annalyn Schooley. I am president of the Florida Family Therapy Alliance. And I am thrilled to introduce a friend that is, I don't know how many years we go
Over
back.
30.
Over 30 years we go back. And to the point that we actually act like sisters
Mhm.
now, including arguing and debating whether IFS is a systemic model and
It is.
all that kind of thing. And no, it's not. And we both work for Capella, and so I asked her if she would please present on imposter syndrome. I knew she had this in her kitty because she had done it elsewhere, and I thought this would be a great thing for our new folks, our registered interns and students, like Megan and Beth. But it never hurts any of the rest of us. I don't know about you guys, but even though I've been at this for over 30 years, I still wait for the next clients to figure out that I'm a complete fraud.
Mhm.
So I will be listening with rapt attention as well. So thank you, Roxanne, and the floor is yours.
So, since we're a small group, and even if we were a big group, I was going to do this anyway. I'll introduce myself just a little bit, what I do, and then I'd love everybody else to tell me who you are, what you're doing, and what kind of interest you might have in this. So, as Schooley said, I go back, I think, and Tommy Boyd knows this too, probably. I started my master's in 1992 at Nova. Then graduated with my PhD in 2002, so that took all of 10 years, plus had a lot of life issues going on at the same time. And I've been practicing that whole time. And like um, Annalyn said, this doesn't go away. We always think about imposter syndrome as something that just affects the newbies. But I had a conversation just today with somebody who had been a student of mine years ago, and she had one of her clients overdosed, is alive, and called me and said, she just wants to make sure her documentation is good and looks good. But she says, she started saying, like, I don't think I'm good at this. Should I really be doing this? What did I miss? So I think this is something that no matter if you've been practicing a long time or you've just started practicing, that it will bite you at times. So I'd love to go down. I know Robin, but if I could call you out and say, just introduce yourself, what you're doing, if you're practicing, how long you've been practicing, what's your specialty, anything like that. So Robin, I'll start with you since you're like next on my screen.
All right. Little frog in my throat. So I've been practicing. I was licensed in 82.
Mhm.
I got my master's in 75. So do the math.
Yeah.
So I closed my brick and mortar office. I work just virtually.
Mhm.
I'm seeing couples and individuals and a lot more Medicare. I think that, people my age want, some mature people. But I have to say, I'm still there in terms of when somebody who is educated and mature, or even, educated and younger, will say, we want somebody mature who's been experienced. And I'm thinking,
Uh-oh.
uh-oh. Yeah, I've gotten a couple of those calls recently, and I'm thinking, ha, ha, ha.
Mhm.
So it still is there, and
Mhm. Yeah, that makes a lot of sense, right? Great.
I
Thanks,
cut,
Robin.
yeah, okay,
Thank you.
good.
Renee, how about you, Renee?
Good evening, everybody. Yes, Renee Gillimbardo. I've been practicing for 30 years. I'm a transplant from California, which is where I went to school. And I remember in a former profession, I taught college for a while. And in a former profession, I remember one of my supervisors said to me, if you stop questioning yourself, then I'm going to worry about you. And I
Great.
don't think I've ever forgotten that, whether it was when I was in education or in mental health. So I think it's important, and questioning myself is a often thing, particularly in mental health, and particularly I think these days.
Yeah,
Yeah.
things are changing too. It's keeping
Yeah.
up is really hard. Yeah.
Hmm.
Thank you, Renee. Karen, how about you?
I'm Karen Bogart. I've been, gosh, licensed, started grad school in the early to mid 80s, and work in private practice in Maitland, working with um, sex addiction, trauma. Lots of people have imposter syndrome, so I thought this would be a good thing to attend.
Thank you. Great. Is it Linda? I know there's two N's. I know you're on mute too, so I think you're on mute, Linda. I'm not sure if Annalyn, if you can unmute, or I'm not sure.
I don't
Sometimes.
think I can, but Linda, we can't hear you. Just so you know, Linda, we can't hear you. So figure out your mic and we'll move on to the next person.
Yeah. So, Tommy, how about you? Oops, I didn't mean to.
Well, I am one of the oldies, and I keep plugging along.
Mhm.
Um, I've actually been licensed since the 70s in South Carolina before I moved to Florida. So it's been a number of years. Was at Nova Southeastern University and retired from, professor, uh, department chair, associate dean, and have continued my private practice throughout all of that time. So I still do private practice, not as much. I'm kind of gearing down a little bit in my retirement time. So that's where I am.
I remember you and I working at Atrium together.
Oh, absolutely.
Remember that? That was
Oh,
years
yeah.
ago.
Uh-huh.
Actually,
It's still
Tommy,
there.
you are responsible for Roxanne and I both being in the AMFT, doing my being in FFTA and all that. You're directly responsible because you twisted Roxanne's arm and twisted my arm, and
I thought it was.
that's
I thought
that's
it
what
I,
we did.
was.
I appreciate it.
All right. Beth, how about you?
So I graduated from Capella in December of 2024. I have not, I just started being a registered intern recently because my husband had passed away while I was in my program, and I just have taken some time afterward to process that and deal with the estate and everything. And I just am Dr. Schooley's biggest fan and one of your fans, Dr. Bamond, because I still see your presentation about if someone says they have suicide ideation. You did this amazing presentation, and I still hear you in my head when that kind of thing comes up. But I'm really glad to be part of this group and get excited about getting going finally now that
Great.
I can. It's 2.5 years past my husband's death, and I feel ready.
Okay, great. Thank you. Margie, how about you?
I just unmuted myself. I graduated from Stetson University and I was licensed in 2011. I am in private practice in Maitland and Lake Mary, excuse me.
Mhm.
And I work with individuals and couples, but I have what's called a fellow in thanatology, which means I have expertise in the field of death, dying, grief, and bereavement. And imposter syndrome for me hits really hard because I know when I give my fellow in thanatology, they say, well, what does that mean? And I say, well, it says I'm an expert in this field. And I'm always learning in this field. So it's saying an expert just doesn't, it still doesn't resonate with me because I learn
Mhm.
more from my clients than I do from my training, so to speak. I think there's a good balance, but I'm grateful to be here and I'm really happy to see Tommy Boyd and Anna Lynn. I haven't seen you all in a while, so I'm happy to be here.
Yeah. Well, thank you. And I'll
Yeah.
have to remember that word. So say it again and
It's a fellow in thanatology, and it's through the
Thanatology.
Association for Death Education and Counseling, which is an international organization. They're one of the best training grounds for those who want to deal in the field of death, dying, grief, and bereavement. So there's a lot to learn. And
Mhm.
as I say, I learn
From your
so
client.
much. A very humbling. I
Yeah.
love the work. It's very, very humbling. It really
Yeah.
is.
Wonderful. Linda, I think you're off mute now.
I am. Hooray. I've been in private practice. It'll be 48 years next month. Got my license in 1978 in California, got my license in 1994 in the state of Washington, and moved to Florida in 1994 after I left. No, wait. Washington was 92 to 94, sorry.
Mhm.
Um, I've been an expert witness, qualified in 12 states in 4 areas of the law: personal injury, family law, criminal law, and business and employment law.
Oh,
And that's been very rewarding. And I especially like putting pedophiles in prison. That's one of my specialties.
hmm.
Let's see, what else? I have 2 books on Amazon. The second one is called Surviving the Toxic Workplace, published by
Oh,
McGraw-Hill. And that's been just a wonderful experience. They were a wonderful publisher.
excellent.
And I've been vetted by the Mayo Clinic and chosen from 200 people in a national search to host Ask the Family Therapist on America's Health Network, which was associated with the Mayo Clinic. So that was fun.
Bet you
And
you have I bet you don't have imposter syndrome.
I really don't. And
Yeah.
I'm very grateful to my parents for that.
Oh, good. Maybe we'll talk about those of us who, when we don't have imposter syndrome, what do we credit that to?
And I'll credit my parents. And I've worked with a lot of people with imposter syndrome.
Sure.
And you just have to keep breaking it through because they're in denial and they don't want to own their power. That's part of what I see. Okay.
Oh, they don't want to own their power. That sounds cool. Thanks, Linda.
My
I'll,
pleasure. Thank you.
oh, I'm sorry. Are you done?
Yes.
Okay, thank you. Megan, how about you?
Hi, everybody. Thank you, Dr. Bamond and Dr. Schooley. You two are both of the leaders that I'm currently following. However, I sit in this room and I just feel so grateful because I know that as a student, I'm still currently in my master's program at Capella. I'm towards the end of my programming and I'm about to start my internship in July. What a gift to be able to sit amongst all of you with decades of experience. And I just wish that so many of my classmates would take these opportunities because the books are great, the schooling is great, and the experience and the practice, but getting to learn from you guys is something that is very unique. And I appreciate it a lot. So I'm super grateful for that. I'm in Jupiter. I'm born and raised in Florida. I've been in the field of behavioral and mental health and substance abuse for about 15 years in different arenas. But yeah, studying to be in marriage and family therapy and seeing where this all takes me has really been the true passion and goal. So I'm very excited. And Beth, I think I've always thought that I was the biggest fan of Dr. Schooley. So I challenge you. But yeah, this is really great. So thanks again.
Well, I'll
We
just
will
let you,
talk, Megan. We'll make a club.
well,
Yes,
I,
yes.
I just will let you know I'm the biggest fan of Dr.
Yeah.
Sweet.
Do I need
Dr.
to leave the
Schooley, you're
room?
loved for sure.
I see Karen and Abby are off. If they like to come back on, that's fine. If they're just observing, that's great too. Whatever they would like. Karen. Yeah. There's Karen.
Hi, I'm sorry. I ran in and trying to eat dinner and catch this too, so forgive me.
No problem.
I'm Karen Harmon. I live in Northeast Florida, and I have been licensed since 2022. I am in a private practice here. My focus is OCD and anxiety, and I do like for fun marriage counseling. That's kind of like,
Mhm.
you know, um, but again, when people are like, who's the expert in the room? I'm like, I'm looking for them too. I love what I do and I love the challenge of it. And when people see the value of my work, I'm always so just blown away, and grateful, that I've given value to someone's life. I've changed the trajectory of how they've been feeling, but I never feel like that I'm qualified to do so.
Yeah. Yeah, that's familiar. Yeah. Abby, did you want to come off or if not, that's fine. Or
Yes. Yeah, sorry, I'm on the way to somewhere. So, I also am at Capella and so new to the field in general. I'm in internship 2 right now, so the imposter syndrome is definitely something that I've come in contact a lot with, and my supervisor is on the FFTA board, Lynn Arter, so she actually recommended me coming to this. So yes, I'm looking forward to learning from the pros some tips and tricks.
uh-oh. All right, well, glad you're here, Abby. And
If we
then
find any, if we find any pros,
yeah,
we'll ask
well, we have
them.
a
Okay,
lot of
yeah, send
pros
them my
here.
way.
Yeah. And Diane, I see you. If you wanted to come off or not, I know your name, so you Capella also.
There she is.
Hi.
Hi there.
Hi. I'm in Florida. Also with Abby. We both have Lynn Arters as our supervisor. Um, I'm really excited to be here. I think my supervision today with Lynn was about imposter syndrome. I feel it. I feel it a lot. I'm in internship 1, so looking forward to what you guys have to say.
Great. Well, we're happy you're here. All right. Well, let's start off. Everyone got a chance, right? I don't think anybody left anybody out. So it sounds like we have a lot of experience in the room, but what I'm hearing is that doesn't stop us from feeling at times, what the heck are we doing? Are we supposed to be sitting in that chair across from our clients? But I just wanted to, have a discussion. What do you believe are the qualities of a good therapist, a competent therapist? Let's say, according to just you as a professional, what are some qualities?
Empathy,
Empathy,
Listening.
listening,
Mhm.
compassion,
compassion, empathy, listening,
Engagement.
wisdom.
wisdom. Wow. Okay. That's where I start to feel like, uh-oh, can I do wisdom? Okay.
Being curious.
Curious,
Curious, yeah.
Open-mindedness.
open-mindedness. Great. What did you
Making
think?
connections,
Oh, I'm sorry. What was that?
making connections, able to make connections.
Connection.
Yeah.
Well,
Yeah.
what creates connection? I'm hearing empathy, compassion, um, open-mindedness,
Altruism.
Ability
altruism.
to confront.
What?
Ability to confront when necessary.
Yeah. Okay.
Yeah.
That's a quality of a good therapist, the ability
Yeah.
to confront when necessary.
Sitting
That
with
is one of our
discomfort.
micro skills where when we're teaching confrontation, a lot of our students will be very uncomfortable with confrontation. And so, what do
Sitting
you
with
think?
discomfort.
Yeah, it's very uncomfortable for a lot of folks to say, "Hey, I heard you say this, and I'm seeing that. Tell me
Right.
about that."
Yep.
Difference, right? What do you think when you're thinking, okay, clients think a good therapist is, what qualities, same or different, do you hear?
Ability to be heard.
Okay, so they think a good therapist will hear them.
Yes.
Mm-hmm.
Someone who's present with them, being able to be
Presence.
present.
Mm-hmm.
think it's
Has
pretty similar.
knowledge on
Has knowledge.
how to treat different situations.
Mm-hmm. Knowledge, how to treat different situations, maybe like understanding, how to fix things um, in their families or their marriages or even themselves. Um, So how much, I mean, we're hearing some crossovers, but we're also hearing some differences. I think sometimes we often think clients want something of us that maybe we don't have yet. And maybe that is quote unquote knowledge or expertise in a certain niche area. And even if we have expertise in a niche area, do they feel like we wonder if they're getting what they need out of therapy.
Mhm.
Um, so basically, this is just an opening. What is imposter syndrome? We're going to be going through what that means, when it shows up, and what to do about it. So, as you see, so today's focus is students, interns, and therapists. So we have that all of it. We have some folks that have been here for, been being therapists for 30 and 40 years, and some are in internship one. So we have like a wide range of folks here, which is really cool. So we talked a little bit just about this on the last slide, but who or what is a competent therapist? Tom, I know I didn't get to your who you are, but I'm just curious what you think a competent therapist is, Tom. Okay.
Somebody who's actually has knowledge in their practice of their field, capable of listening to people and understanding exactly what their problems are and being very astute and aware of um, what is really going on.
Mm-hmm. Yeah, so someone who
Oh,
really understands what's going on, which can take a while, right? I mean, as a therapist, especially if you're working with two or more people, understanding what's going on, and that can be seen through a model too, because I'm sure a structural therapist might see it what's going on very different from, say, a solution focused therapist, right? So so
hmm.
figuring out what's going on can be tough, especially in the
Uh,
beginning.
ethical, Roxanne. A competent therapist is ethical.
And so our new 2026 standards just came out, and our state statutes are very different, right? I mean, I'm licensed in, well, about to be licensed in my third state. Um, they may be different, right? So a competent therapist in Colorado will report child neglect if the child is seeing parents have a physical fight between each other. In Arizona, when and they might have changed this law, that was not a report. So even knowing your ethics and your laws, that can change too. So a competent therapist is always updating their ideas of what the laws and the rules are in their state, and also, yeah, the ethical code. Great. Anybody else want to chime in about who any people out there who thinks like I know we're probably a lot of us are probably not on TikTok, but there's a lot of folks now, our younger folks, our students and our young interns and stuff who are watching TikTok, and there are these now what looks like very competent therapists out there. Anybody have any idea of what a competent therapist may look like?
You mean physically?
Yeah.
Focused.
Mm-hmm. Okay, they look focused. When my daughter graduated from, she was in a master's program here, and she graduated, and all of a sudden she got a cardigan sweaters, and I said, "What are you doing with a cardigan sweater?" She goes, "Mom, I have to. I'm a therapist." And I thought, okay, so go to self, go to self, so there is a certain look sometimes.
Was there leather on the elbows? I mean,
Listen, I don't know. I was just shocked that I did not have a cardigan, and I'm thinking, well, maybe that's what's been wrong is I don't have a cardigan.
I looked for somebody who looked kind.
Who
in
looks
their physical appearance.
Mm.
Good
I
point.
want to add something regarding like the social media. I've seen a lot of different presentations in terms of a therapist on social media. Some of them are very non-traditional, and that's kind of like the persona that they're trying to take on. And I often have questions about it. A lot of them will say things like things that you'll hear me saying to my clients, and it's so much as a student right now. It's so much of what we're learning not to say. And so like ethical stuff where it's like uh pretty much like if my client gives me something, I'm going to take it. If they say this, I'm going to ask them for that. There's just a lot of dialogue that is traditionally not correct. And then also there's a lot of presentation of people just looking more casual and comfortable and trying to be more of like a cool relaxed feeling. And so I'm seeing a ton of different
presentations. Right. Exactly. That's a really good point. That maybe it isn't the cardigan sweater anymore. Maybe it isn't this professional look. Maybe it's a different look. But again, acting the part, cardigan, I need a cardigan sweater to look the part can very much lead to imposter syndrome. Yeah.
Yeah, okay.
Yeah. So if I was a competent therapist, my clients would be, let's deconstruct that. So if we're doing great therapy, if we're really good at what we do, what would our clients be like?
Coming
Inspired,
back.
What was that? Tired?
inspired.
Inspired.
Oh.
Inspired. Tom, what did you say?
Well, I said either, but I think when somebody mentioned the fact that about coming back, I think with the competent therapist, they would want to come back. They're
They
getting
would
help.
want to come back.
Right. I mean, as the director of the counseling center here, we know the good therapists are the ones that people want to come back.
Yep.
Yeah, I mean, they keep on coming, they're working 4, 5, 6 sessions out, and booking it. So,
Wow. Okay. So I remember my first client in my practicum in my master's program came one time and he did not come back. And I thought to myself, what a great therapist I am. He did not need to come back. He got everything he needed in one session. And
My
my supervisor kindly said, probably not. But again, clients can, I mean, according to some models, clients can have one session and feel like, okay, this is exactly what I needed. Yeah. But clients come back, they're inspired. If you're a great therapist, your clients what?
Reach their
Prefer.
goals.
Oh, sorry.
Reach their goal. Is that what you said, Megan?
I didn't say it. I'm just
That was
speaking out
me.
of turn. I
Oh,
apologize.
Karen, what did you say?
They reach their goals.
They reach their goals. Oh, that's hard. Yeah. Because if they don't reach their goals, if they're not inspired, if they don't come back, what does that tell us? Or what do we think that tells us?
We're not competent.
Yeah. See how
That's
I
not
thought
true.
I didn't understand what they needed and I couldn't give it to them or
Yeah.
didn't give it to them because I didn't understand what
Yeah.
to do.
And that could be first session, that could be first session. You didn't understand and they didn't come back.
Or
That's
they're not
again.
ready to do,
The
maybe
work.
timing,
Mhm,
priorities for the client is what we talked about. You know,
mhm.
what they chose. I think if given an opportunity, I again not experienced yet, so please, like, I want feedback on any of my thoughts. If given the opportunity to reflect and change something, if it wasn't in the direction that they wanted to go or fitting for them, otherwise, I think a lot of it has to do with client willingness
Mhm.
to change.
Right. Exactly. We can know that, like, on a scale from 0 to 10, how motivated are you to change this in your life, client?
Hmm.
And if we don't even know that, their motivation might be at 3. I've had clients over the years where I thought, okay, why isn't this changing? It must be me. There's not, and then realize I asked the motivation question and they were like, I told you from day one, I'm not here to save my marriage. And I'm like, oh, I did not realize that. They were there for the family. They were not there to, and so I'm thinking all this time, like, I must be doing something wrong. This isn't changing. And then but to Beth's point, did I understand? No, I didn't understand. He told me first session, I'm here for my family. And I heard I'm here for my wife. I'm here for the marriage. So yeah, I didn't understand.
Sometimes I
So
think it's a fit. Sometimes
it,
that has nothing to do with competence or not. It's just, some people we fit with, some people we don't.
yep,
Sure.
that's
True.
well, the research shows that, Robin, right? I mean, the research shows that the fit between therapist and client is one of the biggest indicators of, quote, success.
Success.
Well, and
Yeah.
common factors rather than a particular model.
Mm-hmm.
Yeah.
Exactly. So I want to talk about perfectionism just a little bit because what I like to say when I'm teaching, is that it's just amazing how this field draws perfectionistic people into it. Um, I once had a student not too long ago who I gave her a 99 on a rubric on an assignment, and she freaked out because she didn't get 100. And I told her from now on, I'm never going to give you 100. Even if you are 100, I'm not going to give you. I'm a strategic therapist though too, because she had to learn that she'll never be perfect in this field, right? If she's holding herself to a standard that was, crazy.
It tells me that my professors are actually reading my papers when they don't just give me 100. So I generally like it. I'm like, oh, they read it. They had feedback.
Yes,
As long as it's still
exactly.
an A.
Yeah. 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 And there's that line. It's like, okay, maybe I didn't deserve 100, but I
Yeah.
certainly deserved more than an 89, Yeah, there's
Yeah.
that window. But I think that there are some, I mean, since perfectionism is so closely aligned with imposter syndrome, I thought I would bring this in. So unrealistically high expectations for themselves. And this bleeds over into others too. So when you have a client that may not be changing or may not be doing meeting their goals, therapists can often feel very frustrated with their clients because they're not doing what they're supposed to be doing. And it often is a reciprocal process. Then it sort of feels like, well, if I was a better therapist, I would be able to say something miraculous that they'd be, meeting their goals. Um, so also perfectionists, they tend to procrastinate out of fear of failure. Lots of times, folks, might have a problem writing their documentation or, doing that kind of stuff. They also shrug off compliments and forget to celebrate the successes. Oftentimes I will, watch a tape or something and point out what's really did well. And then I might say, here's a where you could, something you might want to try. They hear that part. We often don't hear that, like, we really liked this. This really worked for us. And also we look to and this isn't a bad thing necessarily. I think looking to our clients for approval and validation, right? They looked to us for that. But a lot of times, Annalyn Schooley used to say, I don't know if you still say this with your clients, what worked in this session? What did you like this session?
Mhm.
Right? And I steal that from her, and I also steal everything that I like from other therapists. So, finding not only what they want, but what is actually working. And you don't have to be solution focused to say, there's something we're doing right. Um, so there's different kinds of perfectionism too. And I'm going on perfectionism, and I was going to say, show your hands if you're a perfectionist, but I think most of us have been or are, perfectionists. There's 3 kinds. There's self-oriented perfectionism. That's the unrealistic desire to be perfect in oneself. Other-oriented perfection, meaning imposing unrealistic standards of perfection on others. And then socially prescribed perfectionism involves perceiving unrealistic expectations from others. This is where this last one is like, do I really look like a therapist? Am I really, am I real? Do they think I'm competent? So imposter syndrome was actually defined by Clanton Imes in 1978. And I kind of looked for an older because I thought it's got to be older than that. Um, but this is what I found is the core source of imposter syndrome comes down to having an unrealistic, unsustainable notion of what it means to be competent. So we talked about those things like what's a competent therapist? They're empathic, they validate, they can listen, all those things. Can we always do that? Sometimes I'm not empathic. Does that mean I'm an imposter? Sometimes I misread what people have said. Now I try to reflect back and say, so what I'm hearing is blah, blah, blah. No, no. Just like that guy who said, I told you 5 sessions ago. And I was like, oh, okay. Does that mean I'm incompetent? I think there's a line, we can be all those things with certain clients. We can be empathic and understanding and make sense of multiple people. And still other clients, we're not. I mean, think of your own caseloads. You probably know this. Or some you're like, oh my gosh, we've got a thing going. The fit, like Robin had said, the fit's great between us. And then we have other clients who we walk out of session and say, am I doing anything here? Like, is this, I have clients now are 3 years, and this is just, and I mean, they say they're getting something. I review their goals, we da da da, and I'm thinking, why are they still here after 3 years? I'm sure there's a better therapist out there for them.
But can I add
Sure,
something?
Linda.
My experience with people with imposter syndrome is that they gravitate toward negativity. They love negative feedback. They have a tendency to play martyr. They have a tendency to play poor me. They want nothing but negative feedback, which feeds their low self-esteem and their low self-confidence level.
Yeah.
And they've learned this from parents. They were like the kid who always had to get negative attention, kind of thing. Maybe not acting out, but verbal abuse and negativity. And that's what needs to be called out. It's like, why are you doing this to yourself? What is eating? That you're incompetent, you're never going to measure up, you're a loser. It's like, what does this give you?
Right.
And mainly their identity in the family.
Sure, and I think like good clinical supervisors might see this, right? They might see this in their supervisees and say, tell me a little bit about, why you're picking out like the negative stuff, why you're looking for negative feedback, because just as, I always say as therapists are to clients, supervisors are to therapists, right? So, and Anna Lynn Schooley also, everybody's a client until proven otherwise, another Schooleyism. And our supervisees are going to come in with with this and say, no matter they get good feedback from their clients or from their team, they'll still say, yeah, but you didn't see that piece, or I didn't show that piece, or they're still there. So Linda, yeah, I mean, I think it does. I haven't looked at it in terms of family of origin, but certainly I can't doubt that there's something there that's come from family of origin. But I want to really tease apart these two things, the imposter and inexperience. So an imposter might, and they might not be saying this out loud, like they might be thinking it internally. I don't belong here. I'm in teaching internship 4 right now. They're getting ready to graduate in 3 weeks. And I had a person who I've been supervising for almost a year now. And she told me privately that she didn't feel she was good enough. And I said, well, what gave you that idea? And she said, because she felt critiqued, like she didn't feel she belonged. And she's every way as good as any other beginning therapist. And I was floored by her saying that she just felt like she didn't belong in this profession. She's kind, she's compassionate, She's everything that any client would want to be sitting in front of. So I didn't even know in like 9, 10, 11 months that she was actually feeling that way. But I'm a fraud. If people, if people saw what I really like, hey, how many times, and I wrote my dissertation on this, is, if I had my shit together, excuse my language, if I was a great therapist, I wouldn't have any problems in my own family of origin, my own family. I wouldn't be divorced. My kids would be great. All of that would be wonderful. But
Ooh.
but I'm, or even our families may have asked us, and you're a therapist? Mom, you're a therapist? I'm not your therapist, but yeah, I'm a therapist. But there's that feeling of, am I a fraud? Because in my personal life, this might be going on, which is I should have my life together, or who am I to do this work? A lot of folks feel like, or especially in the beginning, feel like, who am I to do this work?
I
Um,
remember, I remember years, maybe 10 years ago, I was at an AMFT conference, and it was a smaller group, and there was a woman, I think she worked for IBM, and the presentation was on imposter syndrome. And in her research, she found that it was more women who
oh,
suffered from the imposter syndrome than men.
I
Men,
don't doubt that. I have more women gravitate toward this field, so it's not like I've done a quantitative, but I wouldn't doubt that. Now, some of you might know Michelle Weiner Davis. She's a, she and I hike together. Okay, now I saw her in 1990s presenting at a conference. And you can look this up on her website in divorce busting. She charges $12,000 for an extended 2-day session. So I mean, $12,000. All right. And we'll hike and she'll say, I've got this one couple and I see it in her too. And it's not that it's imposter. I don't think she's got imposter syndrome. What it is still learning. Someone said that earlier. It's about, you're never going to know everything in this. And now she's doing a whole shift in her work. And so learning all kinds of new stuff, right? So it's, and she's in her 70s. So it's really, there's a difference between imposter and inexperience. So inexperience and is time to learn more about the topic, the model, the approach. And listen, most of us make shifts in our careers. I might have been working with couples and now I want to work with, or I might have been working with children and now I want to work with families, or now I want to work with, trauma, or now I want to work with in grief and loss. And, so all of those shifts were then, or I want to work in a different model. An experience can also, and this is, I think I would respect any therapist. I don't care how long they've been in the business. If I had something and they said, you know what, let me think about this and let's talk about this in a next session and consult. Like I'm not much into, I haven't studied a lot, or I licensed in trauma. But if someone is coming to me with trauma, I might say, you know what, let me get back to you in that. And maybe I would have to refer them because it's outside of my scope of practice. But that doesn't make me an imposter. That makes me inexperienced. So, folks, what do you see the differences between inexperience and imposter? Like what for
I
you?
would say for
Mhm.
me, in terms of this, I think I mean, obviously I am inexperienced. Like, I haven't been as long, and I think a lot of those things are what I'm experiencing of, oh, if I feel that I don't know enough about this, I must be wrong because I should have it all figured out or whatever. I should know more about this,
Mhm.
which then I think, then I tell myself, I'm like, oh, I shouldn't be doing this just due to lack of knowledge. So I'm hoping it gets less intense maybe as
Mhm.
I get more experience because I think that's what comes up for me the most.
Well, Abby, let me go back to what these folks that have been in the field for 40 plus years have said. When I said, what's a good therapist? And they said they are able to listen, they're compassionate, they're empathic, they have empathy, they want to understand people. Do you think you have that?
I would say yes.
Yes. Yes. Now, do you know the 20 stages of EFT or the 20 steps of EFT?
No.
No. Okay, neither do I, to tell you the truth.
Okay.
But at the same time, that's something we can always learn. But what makes a good therapist, and take it from the experts here. They were like, this is what, and when you're looking for a therapist, if you were to look for a therapist, would you look for someone who could knock through those 20 steps, or would somebody who could sit down and get you and be with you?
Right.
Mhm. Yeah, and
Yeah.
I'm not knocking, because I know Annalyn would turn off the tape right now, but I'm not knocking knowing models well and doing, learning this stuff. Not knocking that. But that there is an experience, but that does not make us incompetent.
I
It
have
makes,
I have a thought that I'm kind of looking for some feedback on. So, somebody in my life, she at the time was probably like 7, was seeing a therapist, and I remember her coming to me. She's like really close to me in my life, my immediate family. She said, you know, Miss So and so said that, she had to go and research some ideas on like different like what to whatever the problem was.
Mhm.
She was going to go get some more information, and then in their next session they would talk about it. And so this child said, am I that messed up that she didn't
Oh.
have an answer for me?
Mhm.
Then like she had to go do more research to be able to
Mhm.
know what to help me with. And
Mhm.
I did not obviously, well, not obviously, but I was like, no, oh my gosh, she's a great therapist.
Mhm.
She is trying to see if there's stuff outside of whatever she maybe immediately thought in
Mhm.
that session or whatever. So my actual question is, when working with children,
Mhm.
maybe you have, even with adults, to be honest, I think that this kind of pertains to both, but um, you know, I'm an over explainer for reasons
Mhm.
that doctor school, I've processed some of my thoughts. I'm like do you get what I'm
I
saying?
call it
How
an
many other
external
ways do I?
processor. Yeah.
Yeah. So I don't want to be, this is like my natural thing is like, should there be more of a level of explaining why you're doing something to help your clients
Well,
understand, like, I think giving myself grace is a huge solution to me in this problem in terms of like not thinking I'm good enough or thinking I don't know enough. I have all of this going through my head all the time. So I
mhm.
think once I give myself grace, I'm able to say, like, okay, it's not actually about me. Like,
Mhm.
but am I getting the right messages across? Am I connecting with my clients and making sure they
Right.
understand why I'm doing what I'm doing? They're the ones paying, they're the ones showing up for the help. So I
Mhm.
think that's my question is,
So,
how do you best give that,
well, I think
information?
it depends on your client, but I heard from the very beginning that this little kid said, "Am I this messed up?"
Hmm.
There's the problem, right? A strategic therapist would go, geez, I have no idea, what to do with you. You're that messed up. That'd be like an Ericksonian approach, right?
Hmm.
Because now we're getting somewhere with this little kid. So now we can
Hmm.
hear, am I this messed up? I don't know. If I have to go figure out some stuff, does that mean you're messed up? You know?
Hmm.
So I guess it's how you spin it. Um,
Yeah.
but again, there's different ways to do it, right? I mean, our interns will say, I'm an intern under supervision and da 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 da, and so I take my cases to supervision. So you're not faking it. You're saying, yeah, I'm in the process.
In this case, the therapist never knew the child thought this. That's
Yeah,
kind of where my brain goes. The
yeah.
child goes home and shares this with a family member who knows, they trust that person because they know that they care about therapy, right?
Hmm.
So, am I this messed up now coming to, and I was aware that this therapist never had an awareness that their client felt this way.
Yeah, okay. And
So, how do
that's
we
true too.
protect that? Or we
Good.
can't
What you
prevent
think,
it, but
that's the next presentation, and you're going to do that because how do you know everything that lands with your clients?
right.
Right?
Yeah,
You
you
can't.
don't.
You
Right.
don't.
Maybe you know them well enough to see like there's a look or there's a moment or there's something weird that happens. And then are you brave enough to go, hey, what's happening? I just noticed you looked away or something like that, right?
Mm-hmm.
But sometimes you don't know how it lands. You don't.
Yeah.
And again, does that make me incompetent? Does that make me an
Mm.
imposter? Right.
Right.
Yeah,
Yeah.
yeah, yeah.
Hmm.
So we all could sort of drum up the feeling of imposter, but I kind of thought of it as this way is, and I see this with newer therapists, and they could be even licensed, and even some people that have been, part of us wants to be in there. I know even with me, I'm like, oh, I can't wait to see these clients, and then it's like, God, no, I don't want to see them. I don't want to see them, so there's that sort of ambivalence around let me in, don't let me in. Like I was just doing co-therapy in a demonstration this past, and Dr. Schooley was there too. And it was like I was with my co-therapist and I thought, oh my God, this is so easy. It is so easy with a co-therapist because I don't have to, like they've got my back too, you know. But what sometimes just the fear of that feeling of like, oh, do I know? Like right 5 minutes before you're going into session. I don't know if that's just me, but sometimes 5 minutes before I go into session, I'm like, oh no, what am I doing? What am I doing here? So there might be that feeling of like, I don't know what I'm doing with these particular folks. There's that persistent feeling of self-doubt, and belief that. So the feeling is that you're like, there's a difference again about I don't know what I'm doing and I got to figure that out and I'm a fraud. I think those are two. One is very helpful. I don't know what I'm doing. What should I do? And we look at our notes and we look at our treatment plans and we look and I'm like, oh, okay. The fraud part is like, no matter what I do, I'm not competent. I'm a fraud. Um, So now, especially for folks like, Abby and others who are sort of in this constant evaluative place, you're bringing your tapes in, your supervisor's watching you, you're and constantly. One of my supervisors, and Tommy and Annalyn know who this is, Dr. Flemons. Douglas was my supervisor for a very long time. He was behind the mirror when I came back. He took the VHS tape, so you know how old that is. He handed it to me very kind of aggressively and said, count how many times you said so in this session. I literally had to go and count how many times I said so. So there's that constant evaluative feeling, like you're getting graded, you're getting supervised, and forget it's even your clients are grading you, your professors are grading you, or and then the feeling of being graded by your clients too. The limited experience, comparing yourself to more experienced therapists, high expectations. Who doesn't compare themselves to more experienced therapists? I watch like Annalyn's gonna cringe by this, but I watch Dick Schwartz, who I think IFS is a phenomenal therapist. I watch them, I watch different people, and I'm like, wow, that's great. And then I have folks that'll say that to me when I'm doing a demo, like, how did you figure that out? So I think that, comparing yourself to more experienced therapists is a way of being inspired. Someone said being inspired is good, but also it could make you feel like a fraud. So I'm going to kind of go to the seniors in the room who are still practicing. And how do you like when does this feeling come upon you, if ever, the feeling of imposter?
I think for me, it's about expectations.
Mm-hmm.
The client, if I get a sense that they are expecting some kind of miracle or that
Yeah.
pearls of wisdom are going to come forth from my mouth and spill out,
Mm-hmm.
then I'm
Robin, how do you know that's what they want? Like, is that something internal to you? Like, you think they want that, or they're saying, "Tell me, Robin, what I should do."
I think a lot of times it's overt that such as, well, we've already seen another couples therapist, but we want somebody who's more experienced. And we looked at your profile and you're it.
Oh yeah, okay, yeah, that's perfect. Yeah. Tommy, I thought you came off. Did you come off of mute? Oh, you're on mute. Yeah, you're on mute.
Okay, take it off. I've with what's mentioned that mostly when all of a sudden you find that you do get a little bit of get stuck with somebody and you're not quite sure what direction to go. especially with when I find that you take so many different classes to learn so many different other techniques. What's really the one that's going to work with them that I will struggle with trying to figure out what's their. That's the only time I ever really feel like, am I really doing the right one?
Yeah. So, right, that there might be a better technique or a better intervention somewhere that
Yeah.
would help these folks more. And am I using the right one? Right. That will definitely, make us feel like, maybe somebody else could do this better, you know. And Tommy left, but Tommy Boyd. So there's Tommy and Tom. So I saw Tommy had come off mute for a minute, but um what it might sound like. I'm not ready to see clients. A lot of times, and track two, now that's right before they go out, to seeing, sitting in front of real clients. They say, I'm not ready to see clients. And I'm like, well, can you empathize? Can you paraphrase? Are you curious? Are you respectful? Are you all these things that clients want in a therapist? Yeah, like Abby said, yeah, yeah, yeah. Then you're ready to see clients. The rest is just inexperience, and that's okay. I can't believe they trust me with this. There are times in a session you might hear something, from clients that are like, wow, I can't believe they trust me with this. Everyone else seems to know what they're doing. This is me watching, tapes of the experts. It's like, oh, they know what they're doing. I'm not as smart as my colleague, my supervisor, my professor. They would know what to do. I love to say, I love playing Monday morning quarterback. That's called supervision because you can present a case to me and I'm like, oh, did you think about this? Did you think about that? What did you think? And you can get super creative, but you're not sitting in front of the client, right?
Mhm.
So Monday morning quarterback supervision, Tommy and I were talking beforehand, and it's like we love supervision, right? I always call it all of the fun, none of the work, because I could be there creative and helping, but I'm not there in the chair where it can be really hard. Any others it sounds like to you? So when you're in imposter syndrome or you're feeling that come on, that doubt, what does your inner voice say?
I was
I
gonna
think I'm sorry. I think there are times in in our profession and when we're sitting in a room with someone and maybe they've hit a more natural plateau in their progress and in their processing. And that can seem as if nothing much is happening, but
Hmm.
it may be what I call kind of the awkward in between place
Hmm.
when that's the place of great wisdom for people. But in those places, a therapist can wonder, and I know I have, do I need to do something? Do I need to move this? Do I need to move this in any particular direction? And maybe it's just that this is a natural time for patients to take a break. And I don't mean a break from therapy, but just they need some time to
Hmm.
go beyond where they are right now. There's almost a plateau. I'm going to call it a plateau, an emotional
Hmm.
plateau. And sometimes that can affect us. I know that it has for me.
Hmm. Yeah, exactly. That's a really good point. And so if we're seeing nothing changing much in our clients, lives, do we internalize that somehow as I'm not doing it instead of this is a natural plateau. This is probably where they need to be right now, and that's okay. I like that a lot. And it's true. I know even as a client myself, right? We've all probably been clients ourselves. There's times when it's like, yeah, I'm not at my optimal, but this is good. This is where I want to be right now. I don't need to be coming back right now. And I think and some therapists might hold out the expectation that they want more for their clients than their clients want for themselves, right? So like we think, well, they need more work, but they're like, okay, this is where I want to be right now. Yeah. And so we can then again like internalize that. I
I
see
can
that.
totally get with this expectation idea. Either I probably feel most imposter when either the expectations are not clear, or they've changed and I haven't stayed on top of it. or as you just said, that I have an expectation that is not in align with the clients, or that the clients have expectations that are not in alignment with what I'm able to do, or what at least this therapist can do. I always hold out the possibility that some other therapist might do a different job. I don't know about better, but certainly a different job. And that's always a possibility.
Right. Yeah, that's so yeah, we that would be and hopefully we try to get that in the beginning. What are the expectations for therapy? What are your expectations of therapy, of me as a therapist? What are my expectations too? Or being clear about, do we even align in our expectations? The I told you about the man who said I told you 5 sessions ago. Well, when I finally had asked the question, so motivation, he said, I'm a 0 for my marriage. I'm a 10 for my family. Now she quit therapy. She fired me right there and then because her expectation was that I could keep their marriage together. Um, and she said you should never have asked that question, which I still to this day believe I should have asked or heard 4 sessions previous, right? But her expectation is if I was a better therapist, her husband would have stayed in the marriage. Yeah. So being clear about what we can and can't do is great. I love that.
I was going to share that for me, the imposter syndrome has occurred when I'm working with someone who is not able to verbalize what their needs are. They have difficulty communicating. And I've learned with myself to see it as a puzzle. And I've come to do things like I have these cards, sometimes people can show pictures rather than use words. So I have cards, a series of cards that it's called Journey Through Life. And it was created by a doctor, and they can be used in place of communication. So I'll say, it sounds like you're feeling very puzzled where you are right now. And I'm feeling puzzled with you because I'd like to be able to help you. And I'm wondering if you might be able to enjoy working with these cards. And they may say no, or they may say something else, but I remind myself it's okay to see the situation as a puzzle and that I am present in working with the individual so that imposter syndrome doesn't take hold.
Well, just even that creativity right there and being able to sort of pivot, Margie, and saying, what can we do something different? That shows, even in the unknowing place, it shows this competence really. Like
Yeah.
let's try something different. Let's do something different. Let's meet in a
Yeah.
different way.
Yeah.
Yeah. When sometimes, beginning therapists might ask, like I'll say, what would you want to say to your client? If you could say anything to your client, what would you say? And they'll say, I'd say blah, 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 blah. And I'd say, great question, change the tone. 99% of the time, what they want to ask is exactly what needs to be explored. It's just the judgment might need to be taken out of it, or that tone,
Yeah.
or you know. So, but they're afraid to go there, or they don't know how to go there yet.
Yeah. Yeah.
Yeah. All right. So when the doubt comes in, we tend to avoid the woman today I was working with, who again, she's been a therapist for a while. She's like, maybe I just won't take any, this was a 17-year-old girl. She's like, I don't think I'm going to take any adolescence anymore. I'm going to avoid that. That's too hard of a case. That feels like, okay, I don't know what to do. This person, overdosed, and maybe it was because of me. Um, so when doubt gets in the way, we avoid challenging cases. We don't ask for feedback sometimes. I know that sometimes our interns will show us the best cases, and I'm like, no, show us the stuff that doesn't work. Like, that's what I'm here for. That's what you pay me for. Over preparing or procrastinating. Um, feeling disconnected from the role. And this is interesting because when you ask someone, what do you think your role is? And if it is like paying attention, listening, unconditional regard, finding out, they can do that. They're like, oh yeah, I can do that. But when they're feeling disconnected from their role, they've defined their role as something that's probably not what they need to be doing, you know? Um, when doubt gets in the risk of burnout, we see that a lot. And it's not just tired, burnout can show in a lot of ways. We can have a whole session on burnout. Um, this is big, not discussing or showing your work. And I think Tom had said it earlier about, or somebody had said, no matter what, stay in, you stay in, like I'll talk to my friends. I'll talk to Anna Lynn if I needed to. If I talk to people if like I'm stuck with the case. But when we feel doubt come in, we're not good enough. People will judge me. Maybe we stop showing our work. And then again, thinking about quitting, I had a supervisee who was fantastic. She was a post grad, wonderful, wonderful. And I said, and I would watch her cases. She was great. And then one day she came to me pretty much when she was going to get fully licensed and said, I'm thinking about quitting. And I said, what? And she said, yeah. I said, what's making you think about quitting? And she said, it takes me too long to document everything. And she was a private practitioner here, and wasn't working under any Medicaid or anything. And I said, well, let's look at your notes. It took her hours and hours to write her notes. And I thought, it's not the work that's made her, she doubted her ability to document correctly, which I think in our field, a lot of folks are feeling like, well, I'm not good at this because I'm getting, you know, I'm having to be audited all the time. And is that our work? I mean, it is our work? And I don't know. I think it's not always our work. Sometimes, and Annalyn, you probably have seen this too. Sometimes those folks that write okay papers, you're like, yeah, they're not that great. And then they sit down in front of the clients and you're like, wow. So it's not always one to one. Um, any of these resonate with any of us when doubt gets in the way? We do any of this? Yeah. Which one, Annalyn? You're nodding.
Think not discussing and showing my work. Yeah.
Mm-hmm.
Yeah, I'm certainly guilty of that.
Uh-huh. Anybody else?
I think probably that one more than the others, I would agree.
Not
Although I
discussing.
force myself to walk across the hall to Annette's office and say, give me a few minutes.
Mm-hmm. For me, I think it's, oh, I'm
I've
sorry,
been
go ahead.
guilty of over preparing.
Yeah, me too. Me
Over
too.
preparing.
Yep.
How do you know you're over preparing though? Like, what's the difference between preparing and over preparing?
Well, I had a couple in my internship, and I read 3 books and did all this research, thinking that that's what I had to do to be good enough.
Mm-hmm. Yeah, 3 books. Wow. I had
Wow.
I was just teaching a residency and somebody said, well, I would have to read a whole lot about that before and it was a basic case. And I said, well, there's only 2 problems. And they were like, there's only 2 problems. There are only 2 problems in the whole world. Prove me wrong. It's a client has something they don't want or want something that they don't have. Everything else kind of is content, right? And yes, we do have to learn about content. I'm not going to go in there and do something, on death and dying, when I don't have any background or, competence in that, unless I'm under supervision. But basically, when you're ready to sit down in front of a client, you can pretty much understand they have something they don't want or they want something that they don't have. So if you're reading 3 books, and that's not bad, but that feels like you're over prepared, or you're starting to um, try to impose those things on your client. I think maybe that is over prepared. I think more people procrastinate, though. All right. And some people think about quitting, although I think for me, I try to weed out or vet any of the challenging cases, right? And I try to tell, oh, it's because I'm a professor and I don't have a lot of time. No, I don't want too challenging of a case unless I had a team, and I don't. Yeah. So when Annalyn and I start working together again, then we'll take on some challenging cases. All right, so this is where it comes from. Imposter comes from that feeling of perfectionism. I have to be perfect or I'm not good enough. And I think Linda had talked a little bit about this earlier too. Um, and she's talked about this past academic and family pressure to be perfect, right?
Mm.
You know, cultural or systemic bias. A lot of folks that were not your typical therapists, right? Maybe African American women are now very prominent in the field, but before, years and years and years ago, that was like, well, we're not like your typical therapist, so people are going to judge us. So and I always say clients have biases too, right? Not just the field, but and then lack of representation in the field. So I have, students who, I have a mentee right now who has who's white and has a African American supervisee, and they had to talk a lot about that, like because she wanted someone who felt like she was more representative, and my mentee is not, but she got kind of stuck with this person. That was her. So they did a lot of talk about representation in the field. Anything else that goes into, do you think that goes into this? Yeah, Linda.
I always like to ask people what the payoff is for wanting to feel less than, wanting to feel below standard. What are
Yeah,
they getting from this? What does
yeah,
it feed in them? Whether it's being a martyr, poor me, gravitating toward negativity, low self-esteem, low self-confidence. What are they getting from this?
yeah.
And one of the most powerful techniques I've ever found is the two-chair dialogue, where people talk to their mother, they talk to their father, the brother, the sister, the coach, whoever.
The empty chair, like the Gestalt empty
Yep,
chair.
yep,
Mm-hmm.
the
Mm-hmm.
Gestalt. Um, and then, if they're ready, to switch chairs and become the father or mother or brother or coach or sister talking back to them.
Mm.
They hear it from the other person's viewpoint. And
Yeah.
boy, that's like bam, an atomic explosion going off in their brain
Mm-hmm.
about how they cause it, how they are a magnet to it, how they want to milk it and
Yeah.
play poor
Oh,
me, martyr, and all the rest of it.
yeah. And I think and in fact, I think we're going there now. Well, no, let me go. Um, We're actually, that's kind of where we were going to go. Let me see if we're there. Okay, yeah, here we are. So, in a sense, this exercise is like the empty chair, but it's us talking to that part of ourselves that feels incompetent or feels like an imposter.
Right.
So, and we can call it like IFS might call it the inner critic or something like that. But who, and it's always a good thing, right? I believe that even in the imposter is a good part of us. It's probably what is the payoff, you say? The payoff could be connection. I know I got loved when I was hurt or when I played low or when I cried or something. I don't know. I mean, I don't want to get too psychodynamic about this, but
When other people had power over me and denounced me, belittled me, humiliated me, etc. And
mhm.
then they get to
And
see how
that's
that generates.
right, Linda. That's where I find a lot of my registered interns and students is that the environment they're working in has crazy expectations of the
Mm,
number of hours or the kind, and that often leads to their feeling incompetent, not because they actually are, but because the expectations of the boss or of the number of hours they're supposed to produce is unreasonable.
Exactly.
When
Yeah.
you, as a therapist, can be the reality check in that and say,
Well,
that
and
seems
that's why new people
fair.
struggle with that, right? Because
Right,
students and registered interns, they don't know better.
Yeah.
right.
Yeah.
Well, and I would even say post-registered intern, you know, folks that are, they haven't had, so I mean, we ask a lot of times our supervisees about their site supervision. And a lot of times, a good handful of times, it's pretty critical. It's not, they're not getting supervision. I think back to our own supervisions. There were some great supervisors we had. Luckily, I had really great supervisors. Um,
Some terrible ones.
oh God, I had the best supervisors. Like I
Some
really was
terrible ones.
lucky. That really cared about my growth and I didn't put a ton of expectations on me, like or any shoulds. They didn't should me, you know. They inspired me. I think someone used that word inspired. I was inspired by them. Um, so yeah. So meeting your inner critic is, in a sense, I would, we don't have a lot of time now. I think we're done in 10 minutes. So, but I would love to sort of say, going in there and finding the voice that says, you're not good enough. You shouldn't be here. And ask it what it needs. And sometimes it's just saying, I do, like other people said, I just need more information or I need to learn more. That doesn't mean you can't sit in front of clients and understand them. I think the biggest thing that young new therapists do is they try so hard to do the you know the model work, and I know the model work, and they forget to do the connect work. They forget to do, just like, what does this person want? Who are they? I just saw it in track two. I was like, slow down. You cannot be asking these questions till you even get a sense of who they are. So I think it's asking the inner critic, why are you, what do you need me to know? And many times it'll tell you. So, I was going to do breakout rooms. I don't think, do we have time for that? No, we probably don't have time for
Well,
that.
we skipped the working through it slide. Did
Want
you
me to
want
go
to
back?
skip that?
Yeah. So, all right. Yeah, this is not a good slide to skip too. So how do we work through this? We talk openly with peers and supervisors, and I know some of us said when we're in this place, we don't want to share our work. We don't want to say what's going on. But and I always say, if you don't have a great site supervisor, hire somebody that you can trust to say the worst things too. I hate my client. I love my client. Whatever. You need somebody who can sit there with you, right? And not, if your supervisor's scared out of their mind, then you probably need to talk to somebody else. And when you're long licensed, like I will go to my folks and say, I just I don't like this client. And it's very rare that ever happens anymore, because I could hear my inner critics go, you don't like her, do you? And I'm like, no, I can't stand her. And they're like, well, just take a minute or two and just kind of stop doing therapy. I had five supervisors at one case, four that were professors, and one that was a graduate student. And all four of my supervisors were telling me what to do. Here, go in and do this, go in and do this. It was my trigger client. I couldn't stand this man. And finally, the person who was only 1 or 2 years ahead of me in the program said, well, don't do therapy right now. Just find a way to like this guy. Find a way to make sense out of him. Why did he beat his kid like that? Because he's an idiot? Yeah, maybe, but why would he say that? Stop doing therapy and just go in there. She was the only person I could really talk to, because I was like, I hate this guy. I really couldn't say that to my other supervisors. They would think I was incompetent. So she's like, yeah, yeah. So I think there's got to be somebody you can talk openly with, peers and supervisors. Create a mission statement. I have a whole thing on creating a mission statement, who you are and what is your purpose. My purpose is to inspire others to be creative about their lives. That's what I do. I inspire others to be creative about their lives. I help them think outside of the box. I try to think outside the box. That's who I am as a therapist. Yes, do I use all these things? Of course. But what do? I inspire others to think creatively about their life. So really think about, it took me a while to really think about what is my purpose as a therapist. And that in itself, you can always go back to the purpose. I'm here to listen and understand. I am here to care about. I'm here to be a compassionate human being. Whatever that is, whatever your mission and your purpose is, you can go back to that when you're confused in the middle of a session. I'm here to help people think creatively about their lives. And somebody said, I think, let me see, was it Abby who said, I give myself grace? Oh, Megan. Was it Megan who says, I give myself grace?
Yes.
Practicing self-compassion. That's a
Mhm.
big way of working through it. And then reframe your thoughts. You know, is it incompetent or is it inexperience? Reframe. I'm learning with every client. And go back to your purpose. I might not know how this person is ever going to get over the death of their child. I don't have to know how to do that, but I do know how to be with this person. Um, does that questions about any of that?
Well, I think Roxanne, you're bringing up to, self-empower. So
Mm-hmm.
you're focusing on what do I do well? Because I
Mm-hmm.
think that that's part of the antidote for questioning yourself.
Mm-hmm. Right. Who am I? What is my purpose? What do I do there? If it's to fix people, good luck with that because I'd be running scared, you know. I'm humbled all the time by like, wow, how would you get through that? You know? Um, but that's not my purpose. My purpose isn't to fix. And sometimes, clients do want that, right? They want that. I always push them off. I'll say, yeah, yeah, we're getting there, we're getting there. Hold on, I need to understand more. And then sometimes it's like, I'm not the best. Maybe there is somebody, like Annalyn said, maybe there is somebody out there who could do this better. And I would support 100% them finding that. Um, yeah, yeah. So I wanted you guys to name your imposter. Um, I call him Fred. I don't know why. But Fred always tells me, you're not doing this. Like, I'm sure Fred's even talking to me now. I'm probably not listening, but what's it saying? What does it say to you? And then be okay with it. Okay, tell me I very much think of it like IFS, which is there's a part of me that feels this way, and I want to understand it and listen to it like I would a client. Everybody's a client until proven otherwise. And even that part that says you don't know what you're doing, it deserves respect. Yeah. And then this is probably, maybe it fits for somebody, but this is really for more for graduate students. Nobody, especially not your clients, expects perfection. If they do expect perfection, they're probably not your clients, and I wouldn't want them, because that what they're doing is saying they're expecting perfection from themselves too. Ask questions. It shows strength, not weakness. Growth takes time and mistakes. And I always say, to myself, I give myself 10 minutes in every session to make a mistake. I just have to turn around from it. So I hit the wall, I have to turn around. That if you're not making mistakes, then like, what are you doing? And mistakes are, break that word down, a mistake. You heard it wrong or it didn't work. That's a mistake. Um, don't sell yourself short. I would love to hear from Diana, Abby, and Megan about this. Because I think sometimes the folks and Beth that are starting out actually sell themselves short when our research shows that clients rate beginning therapists more effective than long-term therapists. And this was some older research, but I was like, you've got to be kidding. That really punched me in the gut. But it's because they try really hard to listen and they're open and they want to understand. If you don't have a team, you find your team. And then just know, and this group is probably a really good example, is even experienced therapists doubt their work at times. And then we probably know this already. Own your learning process. I wanna that if you're not learning, I mean, right now, if you're not learning, then and there's something to be learning in our field. I came in before all the neurobiology, and probably a lot of us did, and I had to learn like all of that stuff around, neurobiology. And, you know, this was before we even understood autism spectrum, you know. I had to learn what Asperger's were before I had to not learn what Asperger's were. So there's always something in our field to be learning. I think that's it. Um, oh yeah, this is the other thing. Two things here. When you're feeling that imposter, I think taking interesting trainings or you're feeling the burnout, that always inspires me. I don't know about you all, but whenever I take, even if it's a bad training, I find myself going, well, I think differently than that, or I want to do something different than that. So I think taking trainings and then for me, finding a niche practice where, because our scope of practice is just so huge. I always say it's individuals, couples, families, group, and larger systems. And then within all of those, there's 1,000 niche. And some of us are generalists, but like a niche practice can help you feel more competent, and more experienced because you're learning about that niche right there. And then you belong here. Growth is better than perfection. It's greater than perfection. And then we go back to what the people were saying in the very beginning. Your presence and attention matters to clients. That's what it comes down to. And if anybody knows Ted Lasso, be curious, not judgmental. If anybody loves, I love Ted Lasso. And he's like a perfect example of a really good therapist, right? Does anybody not know Ted Lasso? There's some probably, so some people have not watched Ted Lasso. He's like he can act like this bumbling. He was a coach that was hired really to fail this team. They hired this guy because they wanted the team to fail. But he comes in knowing nothing about soccer, or at least about, London. He was in England, and just did what he did great. He was present and attentive, and he learned. He learned a lot about soccer, and he ended up bringing his team, I think, to the playoffs or won. So there. And I think we're on time. Oh my God, we're exactly.
We are. We're right on time. I would, to your last slide, I would add Oscar Wilde says, be yourself, all the others are taken.
Yeah, be yourself. Hmm. Yeah, but learning who ourselves are too is, like who are we in that chair? And I think that for me, that goes back to my mission statement of I help people be creative about their lives. I inspire. That's what I do. I try. Not, it doesn't always work, but that's what I try to do.
All right. Well, let's live the example. What are you taking? Can anyone tell me what they're taking from today, or something that they're gonna make use of?
Yeah.
Anyone? Yes, Abby, what are you gonna take?
Oh, you're on mute.
Unmute for me. Unmute for me, Abby.
Can you hear me now?
Yep.
Yes.
Sorry, I'm at a soccer game. I just appreciate the clarification of it all, because I think maybe it's not as bad as I think it is. And I'm like, oh, going through, I'm like, you know what? Yeah, this is right. Like, I don't need to be that harsh on myself, because one, I'm still learning, and two, I do have clients that come back, and I do have clients that give me good feedback. So I just need to trust in the good feedback and not wallow in the times when I feel like I'm not doing well. That's my takeaway. So
Or
thank you
the
for all
times
the knowledge.
you feel you're not doing well, you get to learn something from it.
Yeah,
I mean,
right.
clients fire us all the time,
Right. The 10,000 ways to not make a light bulb from medicine.
Yeah.
Right.
Yeah. I think when you know yourself, and it's just like that, learning about self, and what you are good at, or you're able to join with a particular population or whatever. But that niche part is moving into something that fits for who we are, rather than trying to be all things to all people. And really continuing to learn about that growth. I think that's the beautiful part is, not take the negative and make it personal, or the disappointment and not make it personal, so it just kind of drags you down, but grow from it and learn from it is the beauty. And learn how to ask the client the questions, what do you need, it's the old, what brought you to therapy, and what are your goals, but letting the client speak rather than us speak for them.
For me, my big takeaway is if I feel imposter syndrome creeping in, I'm going to ask it what it needs. I love that. I love IFS, so
Yeah, what it needs to tell you.
yes.
And then I bracket it. I say, okay, I'll listen. If I'm in the middle of a session, though, what I do, Beth, is yeah, I'm going to hear you in just a minute, but I'm listening, so I swear I will turn to you and I will listen. And sometimes it tells me some really good stuff. Yeah, Hannah Lynn's like, I'm going to shoot myself now.
No, I never said it wasn't a good model.
You just said it was systemic.
I love Fred.
I love Fred. Fred's great. Fred's great.
Anyone else have a takeaway?
I just love being part of this group that I learn stuff all the time. And I think that's one of the wonderful things about, what we do, that we're learning stuff all the time, and our work continues to be interesting. So, and because I'm working in a bedroom, here's my office, and, I have to make an effort to go out and see people. And, I have some ability to do that. Just even this opportunity is great. And so, Megan, you're in Jupiter, I'm in Boynton. And so seeing you and being so excited that
I
here's
used to
this,
live in Boynton.
young, newly experienced, but I think it's great. It really, gives me a lot of hope for, future therapists. Not on my way out, but I kind of am, but I'm not going anywhere.
I love the creating a mission statement. Who am I and what is my purpose? And that will diminish the feeling of the imposter syndrome, because I know when I go in to see a client, I'm always there to do good. And I think that really does help, having that mission statement. Very powerful. Yeah.
Thank you.
Great. Same. I think having a mission statement that supports not just to explain to my clients what I'm doing, but to give myself clarity. So when I feel like I'm supposed to be fixing, or am I being understood? Do they get what I'm saying? And I start going into like control, or feeling less than. A lot of times my thing is like, do I sound stupid? Like all this, the chatter that the stuff in my head. I think having a mission statement that kind of brings me back to the simple basics of what is my purpose here. I'm not a magician. I can't read their mind. Like I can only deal with what they give me to work with, all of this stuff. I think that'll be my thing. And I believe like my biggest takeaway from this is having somebody I can be really open with. That's one thing I'm really taking from this, as I'm new and I feel like, I'm being graded, all that stuff. Who can I go to and just be like super raw and be authentic and open? As long as I'm doing that with one person, I'm being honest. And that's what I'm going to do.
Yeah, absolutely. Okay.
All right. Well, everyone, that is time, but people are needing to head out. So I'll go ahead and stop the recording.